Good night, teacher and classmate. My name is Saray Fernandez. Today I'm going to talk about the topic to ADHD. Introduction. Neurodevelopmental disorders are neurological conditions that appear in early childhood, usually before school entry, and affects the development of personal, social, academic, and or occupational functioning. They involve difficulties with the acquisition, retention, or application of specific skills or information sets. Neurodevelopmental disorders may involve dysfunction in one or more of the following areas: attention, memory, perception, language, problem solving, or social interaction. Therefore, this paper will explain attention deficit hyperactivity disorder (ADHD), its factors, treatment, and methodologies to be implemented by the teachers. What is attention deficit hyperactivity disorder or the ADHD? It is a neurodevelopmental disorder that is reflected in problems paying attention, controlling impulsive behaviors, impulsivity, and being overly active hyperactivity. It affects the ability to regulate behavior, planning, organization, and attention. It is usually diagnosed in childhood and sometimes persists or manifests into adulthood, impacting personal, social, and professional life. Factors: genetic factors, neurotransmitters, molecules responsible for transmitting electrical impulse from one neuron to another. Experience difficulties in the production and interaction of the neurotransmitters such as dopamine, norepinephrine, and serotonin. This can also be caused by chromosomal abnormalities. Environmental factors. During pregnancy and childbirth, the brain forms and matures. This can also be altered by infections, metabolic change, and complications during pregnancies and childbirth. Cause of the learning difficulties due to ADHD. Children with ADHD may have difficulty concentrating on lessons. This can affect their ability to learn and retain important information. They may not hear of or recognize instruction for activity and assignments. They may be distracted by their surroundings or thoughts rather than paying attention to the lessons. Students with ADHD also face difficulties with time management and organizations. This can affect their ability to complete assignments on time. It can also affect their ability to organize information presented verbally and in writing. This can lead to difficulties completing schoolwork. Treatment. The approach should be multimodal and collaborative. The first step is to talking with the parents about the students' behavior, explaining that the child's brain works differently. HD, ADHD is a neurobiological condition that modifies behavior in all contexts. This will be followed by a professional evaluation and diagnosis with school specialists first, who will observe the child's behavior and administer standardized questionnaires, such as the Corner scales, to parents, teachers, and children. Based on the results, the child will be referred to a specialist, a neuropediatrician or child psychiatrist, who will provide the final diagnosis and rules of other possible causes, hearing or vision problems, anxiety, etc. Behavioral intervention and skills training. A child psychologist can work with the child using therapies such as cognitive behavioral therapy adapted to their age to develop organization strategies, frustration management, and social skills. Strategies for teachers to help students. Strategy placement of classroom corners and surroundings. Organized environment. Minimize visual clutter on the walls and keep materials organized. Create a clean and definite workspace. Instructional adaptations. Give clear step by step instruction. Give one instruction at a time. Use visual aids, pictograms that show the steps of an activity. Check for understanding by asking her to repeat the instruction. A strategy for attention and self regulation. Allow with movement. Allow her to have a discrete object to manipulate a fidget toy like a rubber ball or a piece of Velcro under the table. That channels her need for movement without being disruptive. Conclusion. ADHD doesn't prevent children from learning, growing, and thriving. With treatment and support, children with ADHD learn strategies to overcome and adapt to their symptoms. Teachers, parents, and healthcare professionals work together to help them succeed. Every child with ADHD is different and have distinct learning needs and preferences. Supporting a child with ADHD requires a committed teacher to guide them toward the best treatment plan, utilizing knowledge gained from studying learning difficulties and the accommodations to implement so they can access the learning experience they deserve. Thank you very much.